working with laser since 1988. After Tina Crew, who's a Russian physicist, came to Australia after Chernobyl introduced laser to Australia. I did my first degree at Sydney University in physiotherapy, then I did a second degree in manipulative physiotherapy, and since about 1985 I've specialised in complex head and neck pain, including psychogenic headache and TMJ jaw pain. And in 1988, when I was introduced to laser, I found that it helped the 25% of patients that didn't respond to physiotherapy. So since that time, I've used laser in the clinic. So today I'm just going to give a snapshot of the research that I've been doing for the last 6 years. I'm going to talk about laser and protein interactions and looking at an integrated reason why those people respond to laser treatment when they haven't responded to manipulative physiotherapy. So I started a PhD 6 years ago, and I'll just explain a few of the findings and a few of the research that we're going to be doing in the future. So that brings to the talk that I'm going to talk about today, photobiomodulation, which is the new word for laser we have now been told to use, and how it affects protein conformational, so the movement of proteins, which mostly includes ion channels and other small molecules by light. I've been a specialist manipulative physiotherapist since 1984. I began using lasers in 1988, and in 2008 I was influenced by a fellow colleague that some of you here know, Dr. Liebert. And she did some research in 2007 and 2008 about the mechanisms of laser, because she wanted to know why her patients got better with laser when she had given them medical treatment, acupuncture, laser acupuncture, and all the treatments that she gave them. But they seemed to get better with laser, and they got better straight away. They had an immediate pain block, and she wanted to know why. So she booked herself into a molecular genetic PhD, as you do, at the Brain and Mind Institute, and she got some nerves from a rat, and she put the laser on and found out how it worked. So she shared this amazing knowledge with the physiotherapy profession in 2008, and she wanted to reach out to us. And so I was the only physiotherapist who was at all interested, and so she gave all of the information to our practice, which was pretty nice. So she showed us her photograph that she evoked when she put the laser on the dorsal root ganglion in the neck of the rat. And within 10 minutes, all of those little beads, their varicosities, happened. So those little round thickenings in the nerve was able to stop all the neural impulses to the spinal cord and resulted in a neural blockade. And she and her colleagues had an epiphany. This was why they felt better straight away. They had the pain block, and this is why we have painless dentistry. It blocks out the pain in a neural blockade. And I thought this was actually pretty important. In 2009, it won as Neural Spiderwebs the NH&MR Science to Art Award, not the Nobel Prize, but the Art Award. And I thought that it was very significant because we have neural spiderwebs and other spiderwebs in all sorts of scale. And one of those is obviously spiderwebs, but also every other system has a spiderweb type of fractal pattern, and that includes the cosmic one. So in 2009, several things happened to me. First of all, I needed a new laser. My laser was not still working well, so Roberta said, well, you have to try mine. So she lent me hers, and all the patients said, you can't give it back, you need to get one of these lasers. They were better than the previous one. So Brian, my partner who's here, who I have to thank very much for all his help and all my research, because he's a molecular geneticist and I could not have done this without him, although he hates proteins, so despite that he's helped me. He was doing a sabbatical in Gothenburg, and a second sabbatical, and at that time I came up to Radio to meet Lars, and I also went across to Norway and did some meetings with Jan Bordel about laser and what was happening. At the same time, Roberta Chow and Jan Bordel published a meta-analysis in The Lancet, in 2009, and they had sent it off 5 times, and on the 5th time they had sent it to the Lancet, the last reviewer said, this is so good, we have to publish it. So it was published about that same time, which changed the landscape, at least in Australia, about how laser was perceived. So at the same time, I also began a master's at Sydney University in psychogenic headache, and I wanted to do laser. At that stage, Sydney University was not interested in, so my wonderful supervisor managed to get another supervisor down at Canberra University with Gordon Waddington, who was doing laser research. So I was doing parallel masters, one in neck headache and one in laser down in Canberra. And then Lars, when I was here, suggested that I might like to do a melanin absorption study of people with different skin colours, black and white and medium, to look at a dose equivalent equation. So I started 2 parallel masters. So the reason why I wanted to do this was that 25% at least of neck headache patients, and these are people that push on their neck, they get a headache, it's associated with photophobia and other autonomic symptoms, including periocular swelling, and it's unresponsive at 25% to the best manual therapy. It's also unresponsive to injections, surgery, radiofrequency neurotomy, and all the other interventions we have in medicine. So there are no predictors, at least in physiotherapy, and no predictors in the other treatments of who will not get better. So I wanted to know why these people didn't get better. But with Roberta's work and all the other research, 80% of these 25% got better with laser. Now, why would a few photons do that? And not only did they get better, the evidence showed that they stayed better. They were in remission. But 20% of these 25% still don't get better. So why don't they get better, even with the best practice walk guidelines, which we knew about by then? So I wanted to explain the systemic effects of laser, because they're actually better, because psychogenic headache has quite strong systemic problems. And I wanted to look at what the bystander and abscopal effects was and why it switched people to being better. They weren't just symptomatically better. So why did light work when other treatments failed? And why there's still some people that don't get better with light? So I looked for the stimulus of the hypothesis I would look at in this project. So I looked at my own experience, 25 years in my own practice. So I saw people over 2 and 3 generations vertically and laterally. So I had seen many patterns of why people do and don't get better. So I wanted to know why this was. I was influenced heavily by Roberta, of course, who encouraged me to do this. And so what is the explanation of the delayed and continued effects of laser? Why was there remission? And what switch were we affecting? We weren't just alleviating the symptoms. So this was a very hot area of molecular switching about that same time. They looked in Gothenburg University. They found that amyloid absorbs light differently, so do all the precursors of amyloid, which was all the catecholamines, absorbing light differently within the system. They know at the same time if putting a pulse laser light near a dendrite causes the end of the nerve to grow towards the light. But if it was constant, it didn't. And the people that looked at this in the pure research said, we think it may be just emulating macular molecular crowding. So you're looking at where physics and chemistry meets biology. So this is obviously physics. So I had to answer these questions. I couldn't stick with physiotherapy. I had to look at molecular signaling, and I had to look at physics, which is not easy. At the same time, we had to look at the mitochondrial effect of the bystander effects of the nuclear growth factors, and we also had to look at molecular crowding. Same time, there were also other switches being looked at. Same time as I was looking at light switches, pharmacological switches. You might respond to a drug until you're 50, and all of a sudden you don't respond. Because your proteins have aged, those proteins will not respond anymore. What is it about aging proteins and switching? Also, there's been a lot of work at Sydney University with Parkinson's and the abscopal effect. You could put light on your shoulders, head or hips, give the rat Parkinson's by giving them MMP, and if you've given them laser, they don't get Parkinson's, and it doesn't matter where you put it. So you didn't have to put it on the head, although it was a bit better closer to the head. So then at the same time, there were people looking at photonic transmission within the body and whether there is communication of the photons that we release, because we release infrared, at heat because we're warm. We also release all the other wavelengths of infrared. And so I was looking at the fact that we have all of these different infrared sensors, and we have these other infrared processes happening, and I thought maybe I would look at them in parallel. So in the clinic, we know that laser works. One of Brian's father had an ulcer on his leg for 9 months, was beautifully treated with strappings and all the things you did, and it was getting worse. It was smelling and getting worse. He said, look, I thought this laser worked with wounds, because I'm not into wounds, I'm into neck. And so I went out and bought a red light laser, and we treated this nasty wound. This is not his, but it's similar. And in 5 weeks, it completely resolved. So they took photographs of it, and they were very surprised in the medical lab that happened. We also know that it happens in the veterinary, so very good results in veterinary as well. So we know it happens. Why? This is one person from my clinic. It's one of my patients' father was marrying her. He was a minister in the church, and he was not very well and losing a little bit of his cognition, and she was worried she couldn't do the wedding. So she said, I said, well, we can use the laser. Why don't I prescribe a home program? So he had it for about 4 weeks before the wedding. Didn't make any difference. He really, really struggled through it. But they persisted with the treatment. After 5 months, he had to give a funeral, and he was perfectly well. All the relatives came up and said, what's going on with father? You know, he's back to his normal self. And so they kept the treatments up, and he was extremely well. The light was in his eyes, you can see that. But what happened after 1 year? They thought he was better. What did they do? Stop the laser. What happened? Right back to not so well. And so then it took a bigger lag after the treatment. It took about 6 months for him to switch back into his normal self, and then you can see him now, 3 years later, perfectly well with the light in his eyes. So, clinical experience, intergenerational practice, you can follow up people over many years. You have home visits to elderly. I have a lot of patients over 90. You observe the patterns. So you see genetics and epigenetics. Then I decided I would do intergenerational trial, and I would look at a hierarchy of evidence based on clinicians and my observations in the practice, which include treating people with prion disease. So the first hierarchy of evidence, James from 1930s, if we don't know why things happen, we will ask clinicians first. So I asked all the manipulative physiotherapists in Australia that treat adults and children with psychogenic headache. Am I speaking too fast?
Yes.
So all of these people, there are 120 manipulative physios, and they treat adults and children with neck headache. A bit controversial that children have it, but they do. And I said, all right, we know 25% don't respond. Why do you think they don't get better? And so I gave them a 6-page survey. They had to have unprompted answers, and then I asked a whole bunch of questions, and then the last page, why do you think they don't get better? Anything else? And they wrote 6 pages of absolute fantastic evidence of why they didn't get better.